love a perfect pair of jeans that fit just right because they make me feel as confident as hell. But my jeans that I was born with were not so perfect, so I had some tailoring to do. My disclaimers are that I am not a scientist, nor geneticist, or doctor. I am a 33-year-old mother, wife, soldier, nurse, daughter, sister, and runner who made the decision to have a double mastectomy and hysterectomy before my breast cancer mutation 2 gene, otherwise known as the BRCA2 gene, could prevent me from being with the ones that I love or doing the things that mean the most to me. Knowledge is powerful, but that which we gain from the shared experiences of one another is mighty. That there is the essence and purpose of my talk today. I come from a long line of strong and beautiful women. I'm the youngest in my family, so I got a lot of hand-me-downs. Unfortunately, breasts didn't make the cut of goodies passed down to me. Fun fact, there are 5 stages of breast development, the second of which is buds. So while my sisters definitely got my mother's stage 5 breast, I got buds with fibrocystic change. My feelings towards my breasts were unkind, but like many women, I reassured myself that it was their purpose and not look that mattered. But then my breasts were too pathetic to produce enough breast milk to feed my children. And my poor milk quality resulted in a severe weight loss in my youngest. I hated my breasts for that. As for the other female reproductive goods, unlike the rest of my family, I had to wait till I was 16 until I got my first period. And when it finally decided to show up, it stayed around for 18 days. That was the first sign that I had polycystic ovarian syndrome. From there, menstruation would only get more difficult and sporadic. I have lost my 2 maternal aunts, my only 2 maternal aunts, to breast cancer in the last 7 years. My mother and her sisters were best friends and incredible role models for us. The BRCA2 gene is running rapid in my family. That did get passed down to me, and I have likely passed it on to my 2 sons. For me, that meant that in my lifetime, I had an 85% chance of developing breast cancer and a 30% chance of developing ovarian cancer. I didn't like those odds. Inspiration and clarity can come when you least expect it. In 2011, while I was on parental leave with my youngest son, with my oldest son, youngest. Okay, sorry, backtrack. I was watching Ellen one morning when I heard something that would change my life. Christina Applegate was being interviewed about being a new mother. She shared the experience of having her newborn daughter placed on her chest and how emotional it was, using these exact words. "It's a place that I don't have a good relationship with, you know?" I knew. And for the first time, I finally had the words to explain how I felt about my own breast. My broken relationship with my breast was the reason that I could no longer look at myself naked, why I didn't want to take my clothes off, and why I most certainly didn't want to be touched. I knew. I share all of this because while none of this had anything to do with the medical advice or care that I would go on to receive, my feelings about my breast played a huge role in my decision to pursue genetic testing for the BRCA2 gene. We live in a society that is full of preconceived notions and judgments, but our feelings are ours. And we should indeed be able to share with the expectation of respect from those we trust. Like, for instance, our doctors. But my first appointment with my family doctor to discuss referral for genetic testing didn't go so well, and she wasn't very open to making that initial referral. But knowledge is power. And thankfully, I went prepared to that first appointment with the knowledge of my family history, my documented risk for breast cancer, for the BRCA2 gene, and best practice guidelines to advocate for myself and create a learning opportunity for her. From there, all things medical did go rather quickly and smoothly. The family doctor sent the referral to the genetic counselor, who I met with soon after via telecon. My blood work was sent to a laboratory in Manitoba, and when the results came back positive, she sent that letter back to my family doctor, along with a record of our discussion and my decision to pursue a double mastectomy. At that time, I was not yet ready to consider a hysterectomy. The family doctor referred me on to a general surgeon, and I remember that first visit so well, because as he walked into the room with my file in his hand, he said, "I've read your chart, and I think that you are making the absolute best decision." Less than 15 minutes and a short breast exam later, I walked out of there with all of my questions answered, a referral with the plastic surgeon, and a huge sense of relief. From there, I met with the plastic surgeon, who I have come to greatly admire. While the general surgeon was responsible for removing the actual breast tissue, the plastic surgeon would do all things reconstruction. And reconstruction is a pretty big deal. So we talked about size, shape, and feel. He told me honestly that I would never look the same with my clothes off, but that with my clothes on, I would look all right. Not too big, not too small, just right for me. I think he did all right. After a couple of visits, we decided on an approach to use tissue expanders that would go in at the time of the mastectomy, followed by implants and nipples done over 2 subsequent operations. I was pumped. Not really, they went kind of flat. So on October 22nd, the day of the surgery arrived. I was ready, my family was supportive. I was 28 years old. My only hesitation was that in the short time since I'd met with the surgeons, I had decided to fulfill my goal of running my first marathon before recovery would force me into an extended hiatus. Well, you can only imagine what an expedited 9-week training program did to my already barely there boobs. When the surgeons came into the room that morning, I joked with them that I had done most of their work for them, and they were lucky I left the nipples so they'd still know where to cut. I cannot possibly describe the feeling I had when I woke up from that surgery and those breasts were gone, along with all of the feelings of hurt, disappointment, and betrayal. More than that, I knew that I had overcome my risk for developing breast cancer, and my children would never have to watch their mother suffer. A minor complication did buy me a quick trip back to the OR for many uncontrolled little bleeds in one of my breasts. A simple day surgery resulted in an overnight stay on a floor that was already over capacity. My husband had been asked to wait by the nursing station while they finished moving me. When the RN told the porter that he had brought up the wrong patient chart, one for a woman who'd had a double mastectomy, it took some convincing before they'd believe it was mine. The double binder that had been placed around my chest to prevent further bleeding made it extremely difficult and painful to breathe. I have very warm memories of the kind elderly lady in the bed next to mine who rang the bell regularly throughout the night, asking the nurses to help me with that pain. Of course, while all of this was happening, life went on, as did my responsibilities and commitments. At the time, I was taking a year-long French course for work, and I feared that taking too much time off would be detrimental. so I returned 10 days post-op. I was the only female in a class with 6 combat armed soldiers, with whom I had come to form a very close and tight-knit community. I chose to be open with those men about my surgery and the recovery. And I'm so glad that I did, because they were remarkable. At first, I didn't know how much they'd want to know, and I didn't want to make anyone feel uncomfortable. But I welcomed their questions, and they had a lot. While I was off, they had gotten together and solicited the help of their wives to bring me care packages and homework so that I wouldn't fall behind. When I came back, I had opted not to take any pain medication because I didn't want to lose my concentration. And do you know that those men would even go so far as to go to the freezer and get me fresh ice packs if they thought I was looking uncomfortable? I remember one day one of the men came in and he couldn't wait to tell me that he and his wife had seen on the TV that Angelina Jolie had just undergone double mastectomy for her BRCA gene. And he said, "See, that's what Peggy had." The compassion and respect that those men showed me was incredible. Had it not been for their support, I don't think that I would have been able to achieve my career goals that year. Again, the support that you find when you least expect it is amazing. So it was 16 days before I had my first dressing change with the plastic surgeon. That day was the hardest of all of this. When he removed the bandages, he told me that everything was looking great and healing very well, but I was too afraid to look. He made me promise that when I went home and got in the shower, I would take a look. So hours later, I looked at a monster staring back at me from the mirror. That night, I doubted my decision. My husband stayed outside the bathroom door for a very long time, just waiting and being there for me. Thankfully, those feelings were short-lived. As the swelling went down, wrinkles unwrinkled, marks washed away, and I began to see what the surgeon had. But I wish that I had somehow known what to expect, and I wish that I'd have had somebody to share that with me. The rest of the reconstruction went very well. I saw this plastic surgeon every 1 to 2 weeks over an 8-month period for reassessment and saline injections through the tissue expanders. When my breasts reached the size and feel that both the surgeon and I were comfortable with, it was time for the implants. And then finally, the nipples. The nipples were a huge deal to me because they were the only thing I liked about my original breast. Now, who here knows how many different colors and sizes nipples come in? Google did nothing to reassure me. I needed my surgeon to get them perfect, not just okay. When the implants finally settled, we discussed an option to use the local tissue to form the nipple and a skin graft from my upper inner thigh to construct the areola. On the day of the surgery, he did his drawings, and then he brought me into one of the bathrooms in the pre-op area where he stood behind me and he gave me time to make sure that they were just what I wanted. And let me tell you, I have not been disappointed. It wasn't until I was 30 that I decided the time had come to speak to a gynecologist about surgical intervention to prevent ovarian cancer. By that time, my PCOS had made menstruation painful in parts that are difficult to discuss with your family doctor, especially when he happens to be your boss, and not so fun to talk about in public engagements. They were also heavy to the point of interfering with my ability to do my regular activities and work. The guidelines had changed since the time of my original genetic counseling, but thankfully, I had a surgeon who took the time to discuss my file with colleagues across the country and the UK. Her final recommendation was surgical intervention, followed by sorry, this gets wordy, a very low dose of hormone replacement therapy. Surgical intervention would include total removal of the uterus, fallopian tubes, and ovaries. And the hormones were to promote cardiac health due to my young age and to help address the symptoms of the immediate onset of surgically induced menopause. Told you it was wordy. Her research has shown that intervention before I turned 35 would have the greatest effect at preventing my risk and addressing my symptoms. I was all in. The surgery was done using a vaginal approach with laparoscopic assist less than 2 months later. So, other than feeling a little bit more tired than I would have liked, probably because I went back to work after 3 weeks, my recovery went very well, from my perspective. However, my friend Amanda has another version that she likes to tell. Not long after I had my surgery, I picked her up in my car to go for a ladies' night. It was only a short drive, but she asked me 3 times if I was feeling all right. Of course I was. Finally, she started laughing and told me she was freezing. Well, make no wonder. It was -10 out, and I had the air conditioner on full blast. So I've done some tailoring to fit my not-so-perfect genes and overcome my risk of developing breast and ovarian cancers. My body is not the same as it was, and it has taken time to forge a new relationship. When I first thought about giving this talk, I asked a colleague if she thought it was something anyone would be interested in, to which she said, "Why? Do you think that women's health and breast cancer have suddenly gone out of style?" And she was so right. While no 2 women will have the exact same journey, the inspiration, knowledge, and support that I found along the way gave me such strength and confidence. Sharing my story today is my way of passing on that gift in the hopes that it might reach someone else.